The David Pakman Show at davidpakman.com.
Welcome to the bonus show. 15 states say that unauthorized immigrants should continue to count for seats in Congress. And there's now a federal judge who's allowing a New York-led coalition of 15 states and other groups to defend the Census Bureau in a lawsuit that's been brought by Alabama, according to the New York State Attorney General's office at the beginning of the weekend. Alabama is challenging 200 years of precedent in how the federal government decides how to divide up congressional seats, and they use population counts that include unauthorized immigrants. And I get that this is controversial. I mean, I do understand this. If you are here illegally, should you count towards more money being divvied up from federal sources to your district on the basis that your district may have more undocumented immigrants? And this is one of those things, Pat, where when you actually consider the numbers, it is of relatively small impact in terms of what we're talking about, in terms of shifting dollars from one district to another. But it strikes me much like the question during the Democratic debate where they said, hey, put your hands up if you want undocumented immigrants to get health care. Would you give immigrants free health care, so to speak? Even if you can morally defend the policy, it seems like it's one of those things that is only potentially damaging electorally to the left. And my concern is 100% pragmatic on that basis.
Yeah, there's so many people out there trying to claim that Democrats are all about open borders. Of course, no Democrats have actually said that they're just willing to do away with sort of our immigration policy as it is and just completely open up everything to everyone. But that's not what this is. This really wouldn't even be a change to the policy because going back to our nation's founding, we've always counted both people who are citizens and not citizens. We count everyone based on, what their, regardless of what their immigration status is. So that would just be the continuation of that. I think we should see that continue. I guess the best counter arguments to this stuff is that we want to encourage people to come here legally. We want to encourage people to become citizens. So not every right that's afforded to every citizen should be necessarily given to those who aren't citizens, like the right to vote, the right to drive. In some states you can, some states you can't if you're undocumented. But maybe this should be one of them as well, that you're not going to have representation in Congress. I just disagree with that. I think that they should be represented just like anyone else.
There's another issue here as well, which is that you have to consider that the representation in Congress is a particularly advantageous way to frame this. But consider for a second that the reality is that if you cut federal funding on the basis of saying we are going to not include undocumented immigrants in this district or in that district, that district, of course, after you have funding cut, you have fewer funds available. Those immigrants, documented or undocumented, are still there and are still placing a burden. Now, I'm not using the term burden in a stigmatized way. I'm just saying if you have 110 people somewhere rather than 100, that is 10 more people that place a mathematical burden on infrastructure. That's going to have to be paid for one way or the other. So all we're really doing is transferring a lot of that burden to the states. Once you account for that, then it almost becomes less about documented and undocumented immigrants and more just about like who should be shouldering the burden if you are not going to, for example, start enforcing visa overstays, which is a big issue. If you're not going to do that, it's either the state or the federal government who one way or the other is shouldering the burden. I would make the case, and many people might disagree with me, if it's ultimately the federal government's responsibility to set and enforce immigration policy, shouldn't it also be the federal government's responsibility through the allocation of funds on the basis of census results to pay for the burdens that are placed on states on the basis of who's living in those states? I don't know. It sort of seems logical to me.
And of course, we have to remember this is all being done for sort of nefarious political purposes.
Yes.
It makes sense that Republicans don't want to see undocumented immigrants represented in Congress because that's going to lower their influence, their numbers in the House. And, especially when we see like the demographic changes, more people going into California, into Texas, they're going to, of course, be by and large in favor of Democrats and Democratic policies, and they don't want to see that demographic change. And when you can't win over the hearts and minds of people, you go and you use tactics like this. And Republicans have historically been very, very good at this stuff.
Yeah.
We have a new census coming, and like now is crunch time. Now is the time that we have to make sure that this stuff is all in order. I'm glad to see that we got away with leaving the citizenship question off of the census. But they're going to try tactics like this as well, and we have to be able to combat it.
We've talked sort of about vaping on the show, and United States health officials announced that they're now aware of at least 450 possible cases of acute severe lung disease that could have been caused by vaping. Now, anytime you see that word could have been caused by vaping, okay, well, what do we really mean by that? The cases occurred in 34 different jurisdictions. Some of them are still under investigation. It's not completely clear whether they are actually 100% caused by vaping, but there are at least some specific incidents that have been linked to vaping-related activity. Listen, this is going to have to be figured out, and ultimately, Pat, you are going to have people on both sides saying, no, vaping is better than smoking. You will have other people saying, no, vaping is actually worse than smoking in the sense that people believe it's better, so they're doing much more of it. Isn't it obvious that it's not good for you? I mean, I'm surprised there's even really a debate. The only real debate that I think exists is what should be the regulatory infrastructure around these devices in the context of cigarettes, cannabis, whatever else. And when you're talking about vaping, you can vape different, you can vape tobacco, you can vape cannabis as well. And how bad is it? But of course this is bad for you. Like, how could anyone even be doubting that at this point?
Yeah, I mean, you certainly can't argue that vaping is good for you. I suppose the better conversation to have is whether it's better or not than smoking cigarettes or smoking marijuana, for example, because, if you want to try to get people off of cigarettes, then maybe this is the right vehicle for them to do so. If it is, in fact, less harmful on the lungs, isn't as likely to lead to diseases and problems in your future, then I would like to see people transition to vaping because that just seems like a more practical approach.
Yeah, and
but then you see stories like this and it gives you pause.
It's not even about getting off, because I think a lot of people who, quote, switch to vaping, they're not doing it to get off of whatever they were doing before. They're just saying, I'm going to vape instead because I believe it to be less harmful. So I think you're right. We need to know whether it's less harmful, but a lot of people, which is fine, it's up to them, they don't really have an intention of getting off. And that's why I think it's particularly important, if it's not a bridge to get off of whatever you're doing, if it's just, I'm going to switch to this, we really need to know exactly how damaging it is.
Yeah, and it seems like this is something that has just kind of come around in the past, 10 years or so? Yeah. Whereas, like, smoking cigarettes, the actual smoking of cigarettes, like, you have decades and decades of data to look at, and you can kind of make a fair assessment as to what the negative health consequences of that can be. With vaping, if we're still in the nascent stages of it, you're kind of taking a risk because we just don't know. And then when you see stories of teens becoming inflicted with all these harmful things that they're otherwise healthy, and young people that shouldn't be having these health concerns, they're going to the hospital and having to have treatment for this stuff. It definitely gives you pause. But at the same time, we're not seeing it all across the country. Maybe it just has to do with like specific vaping products and not necessarily like vaping itself. Like maybe there's some flavor of nicotine that's harmful, or like the compounds being mixed are harmful when put together. We just don't know what the actual story is here yet. But I mean, I think everyone should have caution. Yeah,
sure. One of the things that's being looked at is vitamin E acetate, which is in almost all of the cannabis-containing vaping products, but I guess not the tobacco ones. And there are questions of, is it vitamin E acetate itself? Is it vitamin E acetate in combination with something that is in cannabis? Is it some other combination or interaction of chemicals? Listen, I mean, I know that a lot of people just don't see eye to eye with me on this because they do want to be using these products for a variety of different reasons. For me, anytime in my entire life, I'm trying to avoid chemicals of unclear nature and consequence at all. So I try to eat unprocessed food as a general thing. Am I saying fast food or whatever should be illegal? No, I'm not saying that, but I'm trying to avoid it because I just assume, given how weak our regulatory environment is, that there's a very good possibility that if there is something harmful in there, agencies that regulate stuff might not find out about it for a long time. It's the same with this for me. It's just that simple.
Yeah, it's a very risk-averse approach. Good on you for being that way. Not everyone is that way, I suppose. People have vices, and especially they're seeking certain effects that they get from these drugs, and they like them. That's just kind of how it is. But I guess if you don't start in the first place, if you just say no, then you're probably not going to go down that rabbit hole. And maybe that is the best approach.
I mean, listen, I drink alcohol, and there are reports that say that alcohol in any amount is a carcinogen. It's just a question of how long are you expecting to live, and how much is the amount of alcohol you're consuming going to shorten your life on the basis of your life expectation otherwise. And then there are other studies that say, well, there may be things in red wine or whatever, and there are social elements to it. I don't know. So I consume some alcohol in moderation, and that may be an activity that also has some negative effect. It just seems like it's so much more clear with products that you're smoking, vaping, etc.
Yeah, amazingly, I actually have no vices whatsoever. Yeah, I think that's just exclusively you that has that problem.
Pat, Pat doesn't remember this. Half the people are just listening. Pat held up a big cup of coffee, which he has like a dozen of a day, which was his joke. So, but I didn't really think you had that much of a problem with coffee. Or I guess maybe you don't really call it a problem at all. You call it a feature.
No, it's not a problem. I don't have any problems. I'm certainly not willing to admit to having any problems. Yeah. And I think we can move on from this because I'm totally fine here.
Speaking of something very serious, Philadelphia was tentatively set to become the first U.S. city to give opioid users a place to inject drugs under medical supervision. This falls under the umbrella of what we call harm reduction, which is there's no government policy that is likely to just stop people from engaging in harmful behaviors. So if you create a supervised injection site for opioid users, you could reduce overdose deaths, you would reduce the amount of harm that comes from it. But maybe not surprisingly, lawyers for the Trump administration are trying to block this. They say that there is a 1980s era law known as the Crack House statute, which they are trying to invoke against Safe House, which is the nonprofit wanting to open the site, and it is going to be fought out in court. Safe House says the Crack House statute doesn't apply because our mission is saving lives, not providing drugs. And the way we are going to save lives is merely by giving people a place to inject the drugs. And therefore, the Crack House statute doesn't apply. I'm not a lawyer, Pat. As you know, my formal training is in pediatrics. But in any case, I don't know ultimately what the legal outcome is going to be. But it is not surprising that merely for appearances, the Trump administration is fighting this.
Yeah, and it's not astonishing, of course. But on the other hand, they did say that they were going to try to combat the opioid epidemic. They were going to try to make that one of the top priorities of their administration.
Here's a way
and
to do
I'm not
it.
sure they've done anything. Yeah, I mean, I don't know if they've maybe allocated more funds into solving it, but this is absolutely a way to do it. It's a totally new approach. We saw that it worked in Portugal. About 20 years ago, Portugal decided to decriminalize all drugs, and they set up centers like this. And what has resulted has been a lowered rate of addictions and less instances of HIV and other diseases getting transmitted. It's been great, and I don't know why we don't take and other countries don't take the same approach here. We continue to fight the war on drugs, and that doesn't seem to be working.
Yeah, the specifics of exactly how you tailor these types of decriminalization, because that's what we're talking about here, right? When you say we are going to provide a place for people to go and inject opioids, but it's going to have medical supervision, even though it's not legally changing the status of what people are doing, it is implicitly decriminalizing it in a way because it is providing a safe haven in which people are not going to be reported. Like the whole idea is police can't raid this place and arrest everyone who's in there. That's sort of how these places are set up. And one of the things we have learned, even though the details vary depending on what sort of implementation you see, one of the things we know is that when you make drug addiction a public health issue and treat it as such, rather than an issue of crime and criminality, people do better, countries do better, and we're better off. And it's not surprising, especially going back to the very beginning when we heard from Trump about drugs, and we heard from Mike Pence about drugs, and we heard from Jeff Sessions, the former attorney general, about how he used to think the KKK was all right until he found out that they smoked pot. It is not coming as a surprise that this is the approach that the Trump administration is applying here. And I don't know ultimately how this lawsuit is going to go, but we will follow it and see what happens. It had potential. It had potential to be a good thing and to actually do harm reduction, which is such an important strategy. It's more than a tactic. It's really a strategy that has been employed when it comes to addiction. and the Trump administration getting in the way. I hope people will send me feedback about the Sam Harris interview. Pat, and now that you've gotten a chance to listen to some parts of it, what do you think? I mean, I'm really kind of just mixed in general about how it all went. On the one hand, Sam was very generous with his time. We talked about a lot of issues. On the other hand, no, I didn't yell at him for everything he said that I disagreed with. I think our core bonus show audience understands that if you treat a guest like that, you get nowhere. Because you don't allow the conversation to proceed. But I know that Sam said things during the interview that many in our audience will not agree with, and I'm interested to see what the feedback will be.
Yeah, I like the interview. It certainly wasn't a debate like you have with some of the guests that we have on the show. You just kind of let him speak, and I think that's good because he's a very he's a philosopher type.
Yes.
And he gets on to some good points when you just kind of let him ramble. And a lot of topics covered, as you mentioned, comparing Trump to Osama bin Laden. I thought that was an interesting one. Some great insight on Trump voters and the cult of Trump and Fox News and reparations. So, yeah, I mean, definitely covered a lot of different topics, but I just want to see another conversation, and maybe that can come in the form of you appearing on his podcast. What is it, Waking Up with Sam Harris? I want to see that.
That would actually be fascinating, and I think it would be extremely advantageous from a public relations perspective. But we will see. I have not yet been invited. I have actually been invited to appear on another intellectual dark web show. I'm not going to say which one. If it happens, I will mention it. It is probably not one that most people would guess, but it's sort of an open invite for whenever I'm in the place where the program is produced. And I won't say more now, but if indeed it does come together, I will let everybody know. That does it for today. New show, new bonus show tomorrow. We've got a full week for you today. Glad to be here.
The David Pakman Show at davidpakman.com.